What's up, folks? So today's video is going to be something that I've been working on, or it's come up a couple times in the past week, and it's very specific. So it's ACL injuries and the role of glute medius and hip stability. So one of the most common injuries in especially young female athletes are ACL tears, and most of those are non-contact. And so there's a lot of research on hip stability as being a precursor or a test to seeing what the possibility or potential ACL tears would look like in the future. And as a rehab protocol, increasing hip stability by focusing on glute max and glute med post ACL surgery. So a crude kind of way to understand this is if I crossed over my two fingers, I have two main ligaments in my knee, right? The top being my ACL. So if I then imagine my other hand as being the rest of the capsule of my knee, that secures these two ligaments. So when I'm constantly living in what we call internal rotation at the hip, right here, what that does, if this is my hip and I'm turning in, what I'm doing is making a weak, basically making these two ligaments very unstable. So we preach all the time external rotation at the hip. So if I take that same scenario, I externally rotate, I get to use the tension of the ligaments to my own advantage. So what we see a lot of times is this constant crashing into the knee, especially in young female athletes, because we're not as stable in the hip as we want to be. So what we want to do is isolate and target glute medius and glute maximus in order to help get our knee in a better position, which would help hopefully prevent any sort of ACL injury. So knowing that kind of anatomy and that kind of pathology for ACL tears, a great way, a great tool. You can use any sort of band that you want. I like these slingshots. They're pretty stable and they add a lot of tension. So I have all my young female athletes do this, and I have a lot of other people do this as well, not just young female athletes, but anybody prone to ACL, or if I see somebody, one of the basic, most simple functional tests we do is just give somebody a PVC pipe when they come in and tell them to do an overhead squat. And if I see a lot of crashing in the knees, I'm busting this out. So what we're gonna do, and there's a lot of ways we can focus on glute med and glute maximus. This is my favorite though. So all we're gonna do is set this right above the knee. I'm gonna set my hips back just a little bit. What I like to see is having my toes forward and my shins vertical when I have people do this. And then all I'm gonna do is take short, choppy steps, trying to keep my torso as stable as possible. I mean, you can feel that already. In a few steps, you can feel your glutes being activated here. So I'll have them walk down and back in the gym multiple times till almost they're too fatigued to continue, to isolate these muscle groups, okay? So again, some of the main points here are, I like short, choppy steps and stable torso, because what you oftentimes see is people going here, right? They're just recruiting kind of through the obliques and not letting us isolate right here on the glutes. So slingshots are great. They're like 20 bucks. You can use any sort of band, really. But toes forward, shins vertical, short, choppy steps. And I always ask, where do you feel it most? And if they do this, then we're on the right track. So great way to help increase hip stability. I also will have them squat with this. So keeping it around the knees. And I tell them to break the band when you squat. And have a great way to activate those glutes as well. So quick little trick. Add it into some training before, some training after, and help stabilize those hips. See you next week.